Okay, palpations for your final exam. The first one is metatarsal phalangeal joint. So any of these joints across here would be your metatarsal phalangeal joint. Then you have your deltoid ligament, which is on the inside. And you have your anterior talofibular ligament, which is over here. The first one you sprained in an ankle sprain. Your extensor digitorum longus. So it is going to extend all of your four toes, and extensors are on the front side. So if you ever pull our toes up, go ahead, you can see them pop out right here, so any of those would be fine. Tibialis posterior is also called TOM. Remember, it runs right along the back side of the tibia and comes on the inside here. It's the closest one to the medial malleolus, and then it ends down here in the foot. Flexor hallucis longus is hairy. So it would be the third one over, and it would come down to the big toe. So you could put it anywhere along that path, but understand it goes to the big toe. Then your peroneus longus is on the outside of your leg. So it starts up here on your fibula, fibular head, runs down the side and wraps behind your malleolus and goes underneath your foot onto the inside. Remember, the peroneus brevis stops short here. The peroneus longus wraps around to the inside of our foot. Calcaneofibular ligament is the second one most commonly sprained in an ankle sprain. It goes from the fibula down to the calcaneus. The cuboid, you can pinch right here. So that is the cuboid. The calcaneus is your heel. So anywhere along here you can put the calcaneus. What's your calcaneus? Your fifth metatarsal is anywhere along this path. This part right here is your fifth metatarsal. Medial malleolus is the end of your your tibia. It's a bump on the inside of your leg. Your talus, you have to have them plantar flex. Then you can find the dome of the talus right there. Third cuneiform is just inside of the cuboid. So you find the cuboid, you pinched it there. The third cuneiform is next. The pesian serine is just an area on your tibia. So remember, it's where you have your three muscles that come in and attach. You have your gracilis, your sartorius, and your semitendinosus. This is the pesian serine. Fibular head is going to be over here. You got to feel for the bump. Hers is right here. Then your suprapatella bursa is just above the patella, right here. Medial joint line. The easiest way to find the medial joint line is to bend your knee up, find the femoral condyle, go off into that space. You'll feel the tibial condyle here. So the open space here is the medial joint line. Okay. Lateral femoral condyle is on the lateral side at the end of the femur. So you can still find it the same way you found the joint line. Just know that above that joint line is the lateral femoral condyle. So right here. IT band is a band of tissue that starts up here in the hip and runs down the leg. So anywhere along this area here is the IT band. Okay. Medial collateral ligament is on the inside of the knee. So any of this area here is medial collateral ligament. Lateral collateral, you can feel if you have them do a figure 4. It's a ropey structure right on the lateral side. So right here. The Gerdy's tubercle is this bump you can see really sticking out on Tristan. That is Gerdy's tubercle. Okay, your patella tendon is right here underneath your patella, above your tibial tuberosity. Oops, I was using yellow. Okay. Rectus femoris is the center quad and hip flexor muscle. So right down the middle. Vastus medialis is along the inside, right here. Vastus lateralis runs along the lateral side, so right there. The adductor longus runs through the middle of her the inside of her leg. It stops about halfway down. The adductor magnus goes down to the femoral condyle. Then the gracilis runs that same path and comes into the pesian serine. The ASIS is the bump on the front side of your hip. So right here on her belt is ASIS. Greater trochanter is out here on the lateral side, so you'll feel for that bump. As Tristan's doing, you can have them go into adduction. You'll find the bump right there. Iliac crest is the top of her hip. So if you took your hand this way, this whole area here is iliac crest. So flip over. The semitendinosus is the long hamstring. Semitendinosus and membranosus are on the medial side. The tendinosus continues around and goes into the pesian serine. Okay, so you'd find it along here and knowing that it keeps going. The semimembranosus follows that same path, but it stops on the back side of the tibial condyle. And so that's where you would find it. The biceps femoris is on the lateral side, and it goes down into the fibular head. So here would be biceps femoris. Then ischial tuberosity is the bump that you sit on. So it would be right here. PSIS are the dimples that you'd see in someone's back. They'd be right here. Gluteus medius is the smaller butt muscle. It's over here on the side. Give me that paper. Okay, and then your piriformis can be found between your sacrum and your greater trochanter, and you go right in the center of those. So right there. So you can sit up, Tristan. Okay, now we'll talk about the shoulder. So the acromioclavicular joint, you're going to follow the end of the clavicle, and then you'll feel the spine of the scapula and the acromion as they come together. That's the acromioclavicular joint. The sternoclavicular joint, you follow the clavicle again and know where it attaches to the sternum.